Now that we've defined the different surfaces of the carpus in terms of where we can position both our beam source and our plate, we are going to look at some positioning and the actual radiographs that we will obtain from the different views. Let's first look at two of the views that you may be most familiar with from your earlier studies, the lateral to medial and the dorsal to palmar views. If we first go back to our 3D model and transverse section of the carpus, we defined the four simplest surfaces as the dorsal, palmar, medial, and lateral surfaces. Let's see how that translates to positioning on our equine patient. In the DP, or dorsal to palmar view, the person holding the X-ray beam source is positioned on the dorsal aspect of the carpus, and the plate is positioned on the palmar surface of the limb. We'll obtain this view, and you can see that we see the lateral and the medial surface of the carpus. So we can see the lateral surface of the radius, including the styloid process. We see the lateral surface of some of the carpal bones, and then the same holds true for the medial surface. We see the medial styloid process of the radius and the medial surface of some of the carpal bones. The accessory carpal bone is completely superimposed over the radius and proximal row of carpal bones in this view. The second view that many of you may already be familiar with is the lateral to medial, or more commonly called the lateral view. In this view, the person holding the X-ray beam source is positioned on the lateral side of the limb, and the X-ray beam is directed through the carpus to where the plate will be positioned on the medial aspect of the limb. Then, if we look at the radiograph that we obtain from this, we can see the dorsal and the palmar surfaces of the carpus. Because of the location of the accessory carpal bone, essentially sitting out here on the palmar surface, this is the one view where we can really see that accessory carpal bone not summated on other bones. I also want to point out that this horse that we use to obtain this radiograph actually has a first carpal bone here, which is not always present.